Good morning. Good morning, everybody. Thank you for being here today so early with us. I really appreciate it very much. Let me introduce first myself, then introduce a bit the session and a bit of housekeeping. My name is Pilar Aguar. I am head of unit in the Director General for Research and Innovation, and I'm delighted to host here such an impressive panel of speakers. I'm sure that we will all have a fantastic session. As you see, the title or the topic is Quality Healthcare for All. Let me just remind you that this is a co-design session, and I don't think you were all of you here with us at the beginning of this event, but in the inauguration of the event, my Director General make a remark that I want to echo now. This is not an event for us to speak, though we will have our guest to sparkle the debate, but this is an event for all of you to speak. We came here to listen to you. Our voice is extremely important for us. We are fully engaged in this co-creation, co-design, and we want to learn from you if what we have proposed is indeed in line with your expectations. So I only will say don't be shy. After our speakers have introduced the topic, please give us your input. That's extremely important. And also, let me start with the first question, though I said that I'm here not to speak a lot. We have Slido. We have an app for the event. And in Slido, for this session, we would just put you a very simple question. We would like to know who's here today with us. What is the constituency that is gathered today? And so could you please just open the app and identify yourself with one of the categories that you are seeing there. So it's just basically for us a way to make sure that we understand your comments, your concerns, your participation, and that we can tailor that in our speeches. So it's only 5:09 now. Okay, it's getting there. Well, while we wait for all of you to vote, I will just now pass the floor to our co-moderators. I'll maybe start with Dr. Martin Seichel. Please, the floor is yours.
So good morning, everyone, and welcome. My name is Martin Seichel. I'm co-chairing the session, and I'm from DG Santé, the Health Policy DG of the European Commission. Just a very few brief words of introduction. As you already know, of course, this is a very important input. This session provides very important input into the strategic plan of what we call the health cluster of Horizon Europe. So health has, as you know, a dedicated cluster. That's quite unique as far as topics go. And we, from a health policy perspective, we feel it's very important to fully engage from the very beginning all the stakeholders, and by all, I literally mean all, the health policy and health research areas. We know that research and innovation is important for everything, but for health is particularly crucial. It's a key driver of what's going on in this sector right now and what needs to happen. Health systems, as we know, and public health in Europe and globally are going through a period of very dramatic transformation, and that is something, obviously, which is directly linked to research and innovation. I'd like to make just a couple of quick points. First of all, to emphasize that within the European Commission, we see Horizon Europe very much as a common endeavor. So Horizon Europe is underpinned by what we call a co-creation process. This means, first of all, within the Commission itself, the relevant services of the Commission, so Directorate General for Research and the Directorate General for Health, we cooperate very closely together. We work very closely together. In fact, we will be co-chairing the health cluster, but also doing that with other relevant services, and there are many who are also involved in health. Member states, of course, because they obviously need also, especially when we come to not only identification of needs, but also implementation issues. The World Health Organization, also here today, key partner in all of this, but also very importantly, the many, many stakeholders we have in the health area. And this is an incredibly rich policy area in terms of the knowledge that our stakeholders, that all of you have, and what you can bring to the table. So this session is an opportunity to discuss with you, to hear from you what you feel needs to be done in research and innovation in health. And I would add what needs to be done to ensure true impact to our health systems, to ensure that what needs to change is changed for the better. And this is important, so when we talk about impact, we should talk about where this impact is needed and how we can also look at not only research, but also implementation of research results. So how do we design a research program that is geared for implementation? So if I could have this slide here, this is quite an important slide. Maybe we could keep that up later. This shows a kind of pipeline that was already been discussed, I believe, yesterday. This is the model approach that we envisage when we look at how we can have this virtuous cycle, policy making, then identifying needs and opportunities. That obviously is input into research and innovation, but then we have to complete the circle by going into deployment, implementation, and that will bring up further evidence needs. So it is very much a cyclical approach. And this, of course, will involve different actors at different stages. So I would very much invite you to keep this slide in mind. So that's all from my end. I would like to, before handing the floor over to the co-chair, I'd like to just remind you, we would like to also maximize time for input. So kindly ask you to keep your interventions within 2 minutes maximum. But don't worry if you have further things to add, because there's also an online consultation which is still ongoing and where you have opportunity to also maybe provide further input. So without further ado, I'd like to give the floor now to my co-chair, Dr. Soumya Swaminathan, who is from, as you know, the chief scientist of the WHO, and she will present also the WHO perspective on this. Soumya, please.
Thank you very much, Martin. I think it's a very exciting opportunity for us as well. As you know, the science division is new, and we're also looking to hear from people where WHO's value add and best role could be in this whole value chain. So I just want to mention that, as you all know, yesterday we had at the UN General Assembly the adoption of the resolution on universal health coverage, and for the first time, a very ambitious resolution adopted by all the heads of state that were present there. So a big commitment globally now for universal health coverage. So the WHO in its 5-year strategic plan, which is very much mirroring the SDG goals, we talk about a 3 billion target. So what it means is that in order to achieve the SDG goals by 2030, we need to do certain things in the next 5 years, and that we've called the 3 billions. We need 1 billion more people under universal health coverage, 1 billion more people protected from health emergencies and outbreaks, and 1 billion more people who are living healthier lives. So we've started now thinking along these 3 billions, and even the research that is needed and the innovation that's needed to achieve the 3. Now, when we think about universal health coverage, automatically most of us think about health systems and healthcare delivery. But I think it's important to remind ourselves that it's about well-being as well. And I think there's a big focus in the Horizon program on well-being. So that means prevention and health promotion are equally important, and I think have been neglected quite a lot in the past. When we talk about research, we immediately think about products, innovations in terms of products, but we need to start thinking in terms of behavior change, in terms of laws and policies outside the health sector. What can the Ministry of Education do, the Ministry of Sports, the Ministry of Food and Agriculture, all the different determinants of health, air pollution, water, sanitation. These, in fact, have bigger impacts on health very often, to keep people healthy. And this is why we see inequities, because it's the social determinants of health. And whether it's Europe or other regions of the world, I think the social determinants are important. The inequities are important. It's important to use data to uncover these. I think the latest report that's just come out of WHO shows that inequities in Europe are increasing, not decreasing. And therefore, it's important to address that and keep gender and equity considerations whenever we think of anything. Just a few other comments I think I want to add to what Martin was saying about the cycle of it's important to remember that, because I think the needs are important. WHO plays a role there by highlighting or identifying unmet public health needs. So we have the WHO's R&D observatory, which shows you how much funding is going into what kind of research in which country by which funder. And when you analyze that further, you see that a lot of funding is actually not going to those areas which, like non-communicable diseases, which actually cause the largest burden of disease, even in low-income countries. So one is the need. Second is, how do you drive innovation? There are, of course, the private sector way of doing innovation, which is a market-driven approach. But then I think here we're talking also about publicly funded R&D and how you make sure that that follows the right principles of access and so on right from the beginning, early stages. And then how do you get innovations to scale up in countries? Big challenge. Sometimes you have a lot of innovation sitting on the shelf, but for one reason or the other not getting implemented. So I think the role of implementation science, the role of behavioral and social sciences research is extremely important. And finally, the role of the public, citizens and people in understanding science, in understanding, I was mentioning yesterday at one other session about the recent survey that was done by the Wellcome Trust on the public trust in science and health. And it actually showed quite the reverse. The higher the education levels in a country, the more the skepticism around some of these things. So that means we're not communicating science to the public, and I think that's a big challenge for us going forward. Thank you.
Thank you, Sylvia. I think already you've really framed very well the discussion that we need to have, not just today, but of course the coming months and years. So I'd like to give the floor now to Professor Mika Salminen, who is the Director of Health Security at the National Institute for Health and Welfare in Finland, but he's also representing the Finnish presidency. As you know, Finland holds the rotating presidency of the European Union at this time. So Professor Salminen, maybe you'd like to say a few words as well, please.
Thank you very much. Thank you, Martin, and thank you, Surya, for the excellent introduction. Actually, this fits very well because indeed the Finnish presidency, its health priority during its term is the economy of well-being. And what does this mean? Well, basically, taking people's well-being into account in all policies is of key importance for sustainable economic growth, productivity, as well as fiscal and societal stability and vice versa. We actually believe that this is a both-way road. A healthy population enhances the societal development, the economic growth, and the other way around. If you have a developing society, good economic potential, you can actually invest in health. So it is a positive reinforcement in both ways. It's not a cost, it's a good investment. So basically, an economy of well-being approach raises the need to develop knowledge base and processes to use it in decision making. Now in Finland, as in many of the countries in this region of the world, we have a lot of data on various issues, not just health, but also other determinants that affect health. And that needs to be put into use. We still have a lot of work to do with that. But actually, in our country, we have had some success in analyzing the data and actually showing how measures work. Health promotion and disease prevention, as well as the access to health services for all, are recognized to be essential elements contributing to well-being, economy, and to the society. And I'm really would like to congratulate the WHO for its work for UHC. It was a major milestone to get this through the UN system and actually have the countries sign up to it. But despite this, and as was already mentioned here, in all societies actually across the world nowadays, we have to tackle the issue of NCDs. Obesity, for example, and its negative effects are leading to the rise of many of the NCDs. not only in the high-income countries, but across the world. However, you can use fiscal measures and also enabling environments. And when I talk about enabling environments, I'm not just talking about the government, but the whole society, industries, the research field, all of it. It can be used to direct consumption behavior. It's been shown that by understanding the behaviors both of people and the markets, it's possible to use social measures, marketing, social research, both on the peoples and the markets, and also regulatory measures to nudge people along to the healthier paths. Actually, smart and forward-thinking enterprises also recognize this. And just to end here, Finland actually is proposing that the Council would adopt conclusions on the economy of well-being in October. The conclusions would include recommendations for measures to EU members, states, and the Commission. Thank you very much.
Thank you, Mika. I mean, I think it's clear also the common themes which are already emerging quite strongly, I think, from both your interventions. I'd like to give the floor now to Dr. Natasha Tsopardi-Muscat, who's president of the European Public Health Association. Please, Natasha.
Thank you, Martin. Perhaps just to introduce myself briefly, I'm Natasha. I'm a public health doctor. I come from a small country, Malta, and I have worked both in the Ministry of Health and in academia. And that has given me the perspective to have this kind of helicopter view, working in research and also in practice. Today, on behalf of the European Public Health Association, I'd like to start out by saying that as EUFA, together with other NGOs, we have been campaigning over the past 12 months for the EU to do more for health. And I think the fact that we are here and we are looking forward to this investment in the health cluster in the forthcoming program is a positive sign, because we feel as though our message has been heard, and we believe that health is really one of the important aspects which the European Union works on, and which allows it to engage better and more meaningfully with its citizens. I think we are heartened by seeing the approach that WHO is taking, and we think that with this wave of new leadership opportunities that we are going to have in Europe, both within the EU and within WHO, there is an opportunity to really chart and plan together, and we're delighted to be part of this process. We have been working together with colleagues in a CSA action called To Reach, which some of you may have heard of, where basically we were examining what do we need to do differently in the next wave of health systems research within Europe and beyond. How can we better share our research experiences? What are the gaps? What should be on the strategic research agenda? And these are some of the key issues that have arisen both during the consultation so far, as well as during our consultation on the future for health systems research in Europe. And I think what has been very clear to date is that whilst a lot of research and innovation has gone into products and technologies, this alone is not necessarily reaching patients and citizens, and less so reaching all citizens across, for example, the European Union in an equitable manner. And in fact, I think it's very timely that we talk about universal health coverage within even a health systems perspective in Europe, because we know that there are several gaps. So how do we square the circle? How do we organize our health systems better to deal with the burgeoning disease that we have out there, because we are still not sufficiently understanding how we need to respond to this new combination of environmental and lifestyle and behavioral circumstances that mean that we still have quite a huge burden of disease that health systems are having to contend with. But also, for example, one of the more neglected areas that we find needs to be given far more attention are issues relating to the health workforce. There's no point in just concentrating research on medicines and technologies. Again, again, there is no universal health coverage unless we have a quantitatively and qualitatively competent and motivated and engaged workforce. And this is an issue which many countries are struggling with. Of course, I understand that from the consultation so far, it is unsurprising that many people thought that health should be a priority. But perhaps what was surprising for some was that 8 out of every 10 respondents believe that we need to give more priority to systems research. We know that whilst many Europeans are enjoying quite a good and healthy life expectancy, this is very much inequitably distributed, and we need to understand how we can better reduce this gap in practice. The theory is there, but we need to see how we can make this happen. I think the preliminary results of the consultation so far and the recent political statements give us reason to be cautiously optimistic. Of course, we need to make sure that we seize the window of opportunity to really shape the future of the program as we would like to see it, going beyond risk factors, diseases and treatments, and really looking at the combination of how people live and how we can build systems that revolve around them. Even when it comes, for example, to the methods and approaches and data that we use, far too often we are still working with epidemiological methods that give ministers and clinicians results based on data collected 5, 4 or 3 years ago. The world is moving so fast, nobody's interested. We need to embrace even new methods of how we actually study epidemiology and research. It's the European Public Health Association, representing public health researchers and practitioners in Europe. You can count on our support and engagement in this process.
Thank you, Natasha. So we'll open the floor now for comments, and maybe we could have the slide with the cycle up, the second slide, I think it was, just to once again reinforce the importance that we should address. That's one, thanks, the second one. All points, so any comments you may want to make on any of those points and how we could strengthen the role that the research program plays in any of those points. Please, the floor is open. Who goes first?
Good morning. That's a strange one. My name is Klaus Niederländer. I'm from the Ambient Assisted Living Association. Sumia, when you talked about good health, that it's about well-being, that it's actually, you know, from the people, they really talk to my heart. Because when we talk about health, we too often talk about disease and not actually about keeping our functional health, keeping the way we want to live as long as possible. The WHO, you're just launching the decade of healthy aging. Because when we talk about health, aging is an important element of that. So I think this is setting a different agenda. We don't obviously have to talk about new ways of dealing with disease and all that, but let's talk about prevention. Let's talk about good health, and that means, you know, yes, that we can talk about technologies in that. We have worked on that, on how people can stay at home as long as possible, how they stay socially included, because all these elements we know help for being healthy. But we have to find new ways. We have to reinvent ourselves. People don't want to do the same thing anymore. And we had a very great lady, 16-year-old, who told us the emperor's clothes a couple of days ago. You know, we need a new system. We need a new operating system. So we need to talk about the people first, and then we need to talk about co-participation, but not only, because we need to co-create and co-own things. And so we have to talk about new business models, which are outcomes-based, which are co-owned business models. We have to talk about our health and care systems even to open up. It's a closed system. You have to open it up to the people. So I think there are a number of different elements. I'm not going to go into details, just to spark first ideas here we need to talk about. We need to talk about ecosystems. We need to talk about everybody in the system, not just doctors and patients. We need to talk about, yes, the different workforce. We need to talk about people in the workplace. We need to talk about social workers. We need to talk about IT. Just some first ideas. Thank you.
Thank you. Collect some more comments.
Thank you for giving me the floor. I am also, like the ladies, both basic researcher at the university. I was, and I'm now representing, I am a member of the CAT. CAT is a Committee of Advanced Therapies at EMA. I just was in Amsterdam, yes, and listened to interesting talk about the position of the Commission within vaccination. Okay. So my question is about 2 points. One is about the member states, because if I understand, I'm still right, maybe not, health was not in the Rome Treaty. So health is still a privilege of the member states. And this creates a lot of problems. And I admire what Commission is doing for health, but at the end, the final word is within the member states. So I come back now to EMA when I discuss with Mr. Guido Razzi, who is one of his main issue is to try to involve more the member states and to try more finances for the patients. Because this is one of his tasks, but after 4 years, I don't think he succeeded well in giving more funds within this field. So I would insist that we have to convince the member states to indeed cooperate, because once you start discussing with them, the legislation is different from one country to another, the reimbursements for medication is different from one to the other. So this, I think, that's where the problem is. And the second one is a little bit more focus on WHO, because I represent also the Belgian Brain Council, the BBC, well known, and we are dealing with the European Brain Council, and we are a little bit worried about the fact that WHO still doesn't make a clear fusion between brain disease and mental disease, if you see what I mean. And I think now with the project of neuroscience, it is a little bit obsolete to still make a difference between mental disease and brain disease. Thank you.
Thank you. I mean, you raise a very important point very quickly, because this issue of the member states, it's true, member states have the responsibility to deliver health systems and design health systems. But first of all, that is a very demanding, very difficult job. And the question is, how can we in the European institutions and through European means support them and help make that task easier, more approachable? Secondly, as Sumia was saying, there are many aspects which are not in health systems, but which impact public health, areas where Europe does have a responsibility. Issues like environment, food safety, worker protection, etc., where there is also a direct responsibility. So it's also important when we look at that to also understand how we should, through the research program and other means, support member states, but also identify things that need to be done also at the European level. So that's a very important point. I see, yes, please raise your hands because the light is kind of obscuring my vision at the moment. So yes, please, I see a hand at the back there. Yes, please.
You don't hear.
Much better the bigger one. Okay, Rafael de Andrés, former president of the AIL Association, now chair of the Assembly of Members of ECRAN. First of all, congratulations for these presentations. And I would like to raise several questions. One is that we need to have more evidence-based implementation. And we need also more evidence-based perceived by the population about how it's doing science. For instance, this is critical regarding vaccines and vaccination. Second, I think that we need also to break the non-technological barriers because, for instance, regarding data, for instance, regarding the implementation of IT solutions on healthcare or care, social care, this is a critical issue because it is critical in order to get critical mass for having a market. And if there is not a market, there will be no investment by the private sector. And we need to provide an expectancy for the private sector. Otherwise, we will have very good, and we have already very good academic research, but later on there is no translation in the economic sector, no translation in implementation. And this is also critical for growth. Last but not least, we have a lot of data. Of course, we need to have more data in a smart way and interoperable, but we can use the already existing data that now are collected in silos with very low level of connectivity. And of course, this is also another relevant question. There are legal questions, ethical questions, of course, and it is necessary research on that. But this is also a critical issue. And of course, money is important, but it is more important to put health in the different policies rather than only to think about much money. Much money can resolve some things, but the important matter is the concept. Sorry for being extended so much. This is my point. Thank you.
No, thank you. You raised some very important points there. I mean, how to turn data into evidence and also the importance of involving industry. I have two requests. I think there was the gentleman here and then up front. Yes, please.
Thank you. I hope you can hear me. Yes. Okay. Andreas Falk from Bayern Anonet in Austria, research organization. What I noticed is that we are talking a lot about money and a lot about health. What I would appreciate if the new funding programs from the European Commission dedicate some budgets to real prevention research on the one hand, and that the member states try to take up prevention as one of the key social system efforts they want to spend money on. I know that it's much more interesting for companies to get high loans for their drugs and things what they can offer and sell. However, if we prevent, we will go the next step in this circle and hopefully come to a faster way to long life and longer healthy life.
Yes, thank you. A business model for prevention is what we need. Thanks you very much for raising that. Yes.
Good morning. Simon Pickard from Science Business, based here in Brussels. I wanted to touch on something that's actually come up in the slides and I think strengthens this entire pipeline mechanism, which is around outcomes. Because I think fundamentally the question about effective innovation in health systems is about identifying what works, what doesn't, and then doing more of the former and less of the latter. So in the last 3 years, we've been organizing a pan-European platform for multi-stakeholder discussions in different member states to look at how outcomes-based approaches, new uses of data analytics, digital technologies, and more can influence better outcomes for health systems, for patients, and for the broader health ecosystem. Now, this has been done with the informal support of DG Sante and OECD, and I think my question/comment is what more can the Commission do in Horizon Europe to build on what's already been done with the OECD, the Paris Initiative, how to scale that up and maybe think about outcomes data in the systems of health accounts and pooling this knowledge about outcomes around the economy of well-being or other frameworks so that there's a better transfer and sharing of knowledge about what really works and how we can align that with Horizon Europe so by the end of Horizon Europe we have a better system for understanding this.
Yes, thank you. And indeed, this would really be a very important input into health policy because we have, in a number of areas, the need for this also to change the way we approach things. As Professor Salmon was mentioning, to stop thinking of health as a cost and as an investment. Please.
I think you raise an important issue of sharing of data, and data analytics become so much more powerful when you have larger data sets which are more representative and also coming from different sectors. So one of the things that we've been thinking about at WHO is also how to get member states, but also the public, to agree to share data, share their health data particularly, in an anonymized fashion, but willing to share it for this kind of large research collaboratives or enterprises, where you can also use artificial intelligence and algorithms to come to conclusions which you can't do if you have small data sets, particularly for the small countries. So I think it's in everybody's interest, really, to agree to this. And I think a few countries, I know Estonia, for example, I think has a system where the citizens have voluntarily agreed to share their health data with the government. So it's a lot about building trust, actually. Because the moment it comes to data, there are a lot of issues around So I think that needs more general public debate on these issues and looking at the benefits and how can you minimize the risks.
Yes, indeed, and how to build trust is an important area of research in its own right, I would say. I think there's a request for the floor at the back, and here as well, yes. Apologies because the light...
There's a lot of glare here, it's true.
It's a bit difficult to see.
Yes, good morning. David Fenner is my name. I work for Saxony-Anhalt, one of the German regions. One of the things that we're really confronted with is the whole issue of demographic change. So it's good to see there's one of the issues that you raised is the whole problem of kind of inequality. I know that has a global dimension, but even within Europe, obviously, we have big differences between individual regions. Excuse me. So one thing that I would like to, or one point that I'd like to make is that it is important as well to not just focus on, and I noticed this is in the program document, there's a lot of focus on digital technologies and research on those kind of things, but to also focus on kind of social aspects. I noted that social research was mentioned, socio-economic aspects that we need to take into account because there's significant differences between well-being and the healthcare systems in the various regions. Another thing, if we talk about a more holistic approach to build on not just digital tech and the advantages that this affords us as well, is to also focus on something which was also mentioned, which I'd also like to support, which is kind of looking at the roles of different healthcare providers within the system, so putting more research into kind of interprofessional healthcare teams working together, so the role of nurses, of doctors, of clinicians, etc. So those 2 points.
Yes, indeed. Thank you very much. It's very important as well, issues which need to be on the agenda, definitely. Yes, please.
Thank you. Good morning.
Yes.
My name is Ilenia Geno. I come from Age Platform Europe, which is the European network of and for people age 50 plus. So I'm very grateful for the previous comment who raised the issue about demographic change indeed, and how health indeed and health prevention should also not neglect a part of the population who is not into the digital sphere so much. But I also wanted to make a point because I appreciated your overview on health, innovation, and well-being and prevention. There is probably one thing that I haven't heard yet is about health information and misinformation. Because indeed we can think and discuss about prevention and public health, but indeed the information, how we get to the citizens, especially in the optic of co-creation, it's key. And misinformation, we know it's something we cannot forget.
It's very important also, especially for some topics, it's really becoming a key issue, I would say. Yes, please.
I'm Viviana Galli. I'm the coordinator of the European Alliance for Responsible R&D and Affordable Medicines, which is a coalition of civil society organizations, patients, and consumers working on access to medicines. So my question is more related to health technologies, and in particular on pharmaceuticals. And like nowadays, globally, but also in the last 5 years in Europe, we face problems of access and affordability for pharmaceutical products. And my question is, considering the considerable public investment in research and innovation that comes from the European Commission, national funding, but also philanthropies and public bodies in research and innovation, be it within universities, basic research, support to clinical trials, how can we actually ensure that products that have received support from public funding are then accessible, available, and affordable for citizens? And we as a coalition and many other organizations across Europe and the world have come up with solutions to actually attach public interest conditionalities and safeguards to public funding. And we do believe that the European Commission, with Horizon Europe and with the considerable amount of money that goes into health research, actually is in a good place to actually be a role model to attach this kind of public interest safeguard. So I would like to know a bit the opinions from the panel on that.
Yes, thank you. And as you know, the President-elect of the European Commission has already announced that as one of her priorities in the health area, how to address, to complement, the information we have, the evidence we have, with also policy decisions and maybe even changes that will need to happen to make sure that we can actually address this issue. So that's very important indeed. Yes, please.
Hello, my name is Aline Kosi-Gantner. I'm responsible for the research at the Foundation Bondnar. We are a foundation who supports the children and adolescent health and well-being. So I think what I would like that we do not forget, even if we are in Europe and the population is rather aging, what can we do to improve the research for adolescent health, for example, because if we look at the global situation, it's really underserved. So that is my point for today.
Thank you. Again, another priority also of the new Commission, as mentioned already. Yes. Yes.
Yes, Rafael Andres again.
Please.
Well, I think some obvious things. First, we need to work in an integrative manner. Still, we are working in silos. The researchers don't know so much about research infrastructures. The research infrastructures don't know so much about the needs of the researchers. We are doing a caricature, but what I am trying to say is that it is necessary to know more about that. We need to provide also careers for the people working in infrastructures, because it is more prestigious to work on research than in the infrastructure. That means that in that case we have a gap, we have a problem. It is not the responsibility of the European Union, but of course some things will be done. And I know that something is also done regarding the mobility. There is another question regarding the sharing data. Everybody thinks that their data are theirs. This is not true. It is for the person and for the population, and the person and the population is the owner of the data, and nobody is more important. So it is necessary to construct trust between the different actors, not to think that the bioinformatics are clever than the clinicians or the opposite. This is also a relevant issue. Public procurement, because if there are solutions, not in the pharma area, but in other care areas in which there is not a path in order to take off, perhaps there is no investment, and perhaps the solutions are not getting critical mass. So that means that this is other areas in which it is possible for the Union to go ahead. Thank you.
Yes, thank you for giving me the floor. I just wanted to comment on a couple of themes that came up here in terms of what do we talk about when we talk about well-being or health. Actually, we are not talking about the health system. We're talking about the whole society. I pick up on the first intervention actually here. So actually, when we talk about research into issues that affect health, we should talk about the whole of society. So there are many branches, anything from community planning to elderly care, to the social sector, to the food industry. Everything actually affects health and well-being. Actually, there's an estimate that, do you know how much of the sort of increased lifespan is caused by the health system, and how much is caused by other preventive measures? 80% are caused by other preventive measures. Most important ones, clean water. Second one, clean food. Vaccines come in. They are, of course, part of the health system, but preventive one. But the curative health system is about 20% of the additional lifespan in modern societies. Having said that, of course, they are essential part, but it just illustrates that when we talk about health and well-being, it's dependent on so many other things than just what we do in the healthcare system. We actually, there we fix the problems that happened because of something going wrong or a disease coming up. So I would like to just encourage you to keep pressing on prevention, but I think we need prevention version 2, because the whole old idea of sort of health promotion, telling people what to do, I don't think that works in the modern era. People listen to, they have so many other ways of listening to messages, and we have to be smarter, and that requires social research, that requires input from anthropologists, even people who I don't have a clue on, but that should be one strong area of research so that we can actually figure out how we can nudge people in the right direction, not tell them what they should do. Thank you.
Thank you. I mean, I would add that really understanding the importance of non-health interventions for health is really important, because that's, I think, where a lot of gains can still be made. Yes, please.
Geert van der Heijden, University Amsterdam. Thinking about inequalities and the unmet needs, the major problem, I said this yesterday in the session here as well, in my view, is accessibility and affordability. Now, if we look at the business model of health, most of the efforts and investment is in the 20%, you say, and that is, as in other business, mainly salaries of personnel and staff. So I want to make a plea for the inefficient one-to-one approach on treatment of consequences of disease and focusing more on the population prevention, being that more efficient in terms of overcoming unmet needs and inequalities.
Thank you. Thank you. And yes, another request here.
Renzo Dalmolin I am from industry, and I just looked to the statistics, and I saw that the representation for industry in this assembly is very low. Maybe one question is how to get more involved in industry in these events. Secondly, I worked on the strategic research agenda, chapter health, on electronic component system. And what I see is that today we have industry involved, but the professional healthcare, physician and clinician, it's very difficult to get their involvement. And what we try to do, for instance, it's to have common calls. It's very important. Just before I heard about silos. Silos is a reality, because you have calls dedicated for clinician, for research, or, you know, they try to have crossover, but there are very little common calls. And for instance, now what we're trying to do, for instance, a common call between Excel and IMI, which means industry, electronic component system, and also drug, medical device, and to have common calls where there are both involved to have, because we have a lot of initiatives, but sometimes very, very little impact because it's all dispersed. If you try to have a bigger project with more intervening all the community, it will have a bigger impact.
Thank you. Yes, I mean, industry has a big role to play also in all of these points, because also in implementation, for example, and they're not just producing products, they can also offer services to support health systems. Yes, please.
One more comment. I highly appreciate the preventive wording from the colleague. Please accept also to add the safety terminology to this prevention. If we respect safety from the very beginning of the production of all the process and to the end of life, we get a huge amount of more preventive activities. So to include the safety terminology, the safety research along the value chain would be very appreciated.
Thank you. Natasha, you want?
Just to make a couple of reflections. Health systems no longer exist within borders or countries. The way in which health is going to be transacted increasingly in the future, borders will start to make less and less sense. And what we are seeing is that member states are recognizing this and seeking to come together to find common solutions to the challenges that they are seeing. But I think that this is important even in the way we think about health systems and health systems research. For example, when it comes to economies of scale with data, I think the European reference networks for rare diseases are exploring at the moment the way in which they can combine data from across different countries and different centers to achieve this kind of magnitude and impact. A second point which I'd like to make is we have to be, I think, very careful that we don't reinforce this narrative of is it healthcare, is it prevention? I think what we are trying to do by saying that we need to really research how we need to transform our health systems is that our healthcare industry needs to become far more a preventive industry. And the healthcare systems that we have today to become fit for purpose in the 21st century need to change. I believe that healthcare and healthcare systems are a very, very large and important anchor for health, and it's about how we can get them to innovate, to transform, and to work really for advocacy and prevention and well-being across the life course. The final point that I'd like to make is I think we need to research far more about governance for health. Whilst we've been talking about health in all policies, I think since the previous Finnish presidency in 2006, which had really given it a boost, in practice, we still see that it is very difficult for health decisions to trump other interests, so to say, when it comes to policy making. And I think more process and political process research for health is also needed. Thank you.
Thank you, Natasha. I think we have one last question, and then I'll try my best to wrap up. Yes, please.
Yeah, thank you. Alistair Leyland, representing the European Public Health Association. The recognition that we have to look beyond the health sector to the impacts of non-health policies on health is music to my ears. It's easy to think of examples from bans on smoking in public places to the potential impacts of, let's face it, Brexit. But there are problems with policy evaluation in that it takes time. You have to have the policy implemented, you have to wait afterwards, and then you start evaluating it. This is problematic from what Natasha was saying earlier, that you do have to wait. You can't get an instantaneous answer. You can't say, right, it's 1 week. Is it working, yes or no? So I was wondering if there was scope to invest in modelling technologies, to look ahead, to model scenarios, to think what will happen in other countries, what will happen in the future, even what will happen now, based on changes we know. Thank you.
Yes, a key issue. I think all policymakers I know would certainly agree very strongly with you on that, because it's not a question of trial and error. We need to have more good, understanding, and also of how we can use evidence generated elsewhere to apply in a different context, maybe, but learning lessons from that. So, thank you very much. First of all, if you still have further comments, don't worry about that, because you're always very welcome to submit those to the ongoing online consultation. So I'm sure nothing will be lost, absolutely nothing. So, but I'll try to mention a few points very quickly, which I think emerged very strongly from this session. First of all, I heard very strongly the issue about prevention, and also as an area of research in its own right, how to prevent properly, linking that, of course, with other factors, demographic change and social issues, etc. Then to have also health systems that are open to co-creation. Health systems are something we all have a stake in, so also that approach needs to be applied there. How to inform the population. When we say inform, is not just to transmit facts, but to do so in a way which is convincing, which is interactive, which people can relate to. That also is a big area of social research. In the importance of involving member states and industry came out also quite strongly, I would say. Several amongst you mentioned the evidence-based implementation issue. We need, and to identify what is the evidence we need, policymakers need, to actually understand what's going on and what could be changed or improved. The breaking of data silos, perhaps this is one area where definitely most progress needs to be made, because we have a lot of data in the health sector, often very high quality data, and I think we all acknowledge only a fraction of that is used systematically to advance public health. Also looking at the socio-economic determinants, very important, especially in the context of health inequalities. It was acknowledged by many we have deepening inequalities globally and in Europe as well, both between countries and within countries. Very important to understand those and see how we could address them. The health workforce element was mentioned, so research on health workforce, skill mix, new ways of working, task shifting, all this also very important. The issue of medicines and medical technologies, because now we have to talk on the plural, and also what is going to change and what may need to change in how we view these technologies, the impact of digital, for example, what we today think of as devices or pharmaceuticals or other products or services may look very different and may need to look very different. And also the point raised about also understanding properly the safety dimension as part of the whole prevention agenda. And of course, the legislation, for example, in the European Union on a lot of product categories is built on ensuring the highest possible level of safety. But that, of course, is also a dynamic issue. What are new safety concerns or issues related to safety? Just to mention the issue, for example, of data and cyber security and the safety and integrity of data. So I'm sure but if I've missed anything, I'm sure my colleagues have been thinking very careful have not missed anything. And as I said, you're very welcome to continue with your interaction with us. But I'd like, on behalf of my co-panelists, to really thank you for your involvement. And I don't know if there's anyone who has a final comment to make from...
Yes. Yeah. So I think you've summarized everything very well, but I just want to add perhaps another note. We've been talking mainly about the European region, of course, because that's natural, we're here. But I think we also need to take a global view, because as Natasha was saying, things are not limited between borders. They're not limited now because with the transportation kind of thing, everything is global today. An outbreak in one part of the world, as we've seen in the past, can get to the opposite corner of the world within a matter of hours, if not days. And so I think we have to, rather than be insular, we have to open up, and we have to really start thinking about health as something which is it's in the global interest. And everything we do for health, we should think of as a global public health good. So whether it's sharing data, whether it's sharing pathogens or pathogen sequences to prevent further outbreaks and epidemics, we really need to start thinking about how we build this kind of a global collaboration in health. And I think partnerships and collaboration are going to be key for the future. Thank you.
Thank you. And indeed, that is a key defining feature of the research program, is to be open to the rest of the world as well. And so thank you very much, and thanks for all your input. It's very valuable, and I'm sure it will help us take the research program to yet another level. Thank you very much.